Welcome back. Well, it's cold now, but spring, it's going to be here in no time, and that means putting away the sweaters and then maybe showing a little bit more skin. And if you are dealing with spider veins or varicose veins and they're making you self-conscious, maybe they're painful for you, there is a fix. Dr. Jeffrey Martinez is a board-certified vascular surgeon with Vein Tech. He is here along with his patient, Chris Eddy. Good morning.
Good morning.
Thank you for being here, gentlemen.
Thanks for having us.
So I want to talk about your story in just a bit first, Chris, but Dr. Martinez, tell us a little bit about what you specialize in, because you're very specific at Vein Tech, what you do.
Yes, at Vein Tech we treat varicose veins and problems around the veins. So many people know varicose veins. It's something that everybody can diagnose. You see them, you know you've got them.
Right.
But they can lead to more intense health risk, including breakdown of the skin, discoloration, and ulceration. And those are things we like to prevent. They do cause a fair amount of pain and discomfort that can interfere with people's lifestyle and activity level. And we address those things at the clinic.
And Chris, you are a patient of Dr. Martinez. You were dealing with varicose veins.
I've had them for many years.
Okay, so how did they affect your everyday life? What was it painful? What did it prevent you from doing?
If I stood up for a long time, just standing in line, maybe at the grocery store or something like that, then my leg would begin to feel really heavy, uncomfortable, throbbing a little bit.
Just affecting your daily life.
Sure, and sitting at a desk, I would just try to keep my legs propped up all the time, which is not always easy to do.
Right, not in the office.
Exactly.
It's not always easy to do.
In a conference,
Right, excuse me guys, don't mind me. Well, I believe we have some pictures. Now, these are not your legs, but it's an example of varicose veins and the type that you were suffering from. So again, what did you have done? Dr. Martinez, what did you do to help Chris out?
Well, we generally address the veins in sections. We like to treat the deeper veins first, followed by the ones that you see on the surface of the skin. And so we use a technique using radiofrequency ablation that's done within the vein itself, where it uses thermal energy to destroy the inside layer of the vein and seal it up.
Now, is that process painful? Was it painful for you, Chris?
No, I went in, they used a local anesthetic, which, so it's like getting a shot, like a pinprick. After that, I didn't feel anything, and the procedure was extremely quick. I mean, the prep work maybe took 20 minutes to scrub my leg and all that. The actual procedure took less than 10.
So then you had this done. Tell me about the results.
Instantly, I mean, my leg, first place, just looked a lot better. And I felt better. I'm able to stand for long periods now without the same kind of discomfort that I had before. I used to have trouble with, again, during the day, my ankle would start to turn blue because the blood wasn't circulating properly, and I no longer have that issue and stuff.
And so quickly, you could get it fixed. And everything is done in one location, so you do everything in office.
We do everything in the office. It's an outpatient procedure. People go home the same day and generally can resume their regular activities later that day or the following day.
Now that's a win-win for me. So who is a candidate? Who needs, if somebody is having trouble, who is a candidate for this procedure? Does it have to be, really bad to the level that, Chris was at?
Well, for this type of procedure, you do have to have some of the deeper, longer veins involved to treat that. Now, for the ones that are on the surface, we have other techniques that we can use, and most of those involve removing them. Again, we do those as an outpatient procedure in the office, and there's a little downtime with that as well.
Well, again, a lot of people, for you, Chris, it was painful. It was affecting your everyday life. But for other people, maybe if it's not painful, they're self-conscious about it. Especially women who in the warmer months want to wear, shorter shirts and skirts, and maybe they don't, want to do that if they're feeling uncomfortable.
We see a lot of folks that just want to get rid of them too. They don't. They're unsightly and they're self-conscious about them, and we can help those folks too. It is important to know that that's considered cosmetic surgery and generally not covered by the insurance. But if you are having problems with them, most insurance companies will cover them.
Okay, good to know. Thank you both for being here and for sharing your story, Chris, and for letting us know what you do, Dr. Martinez. And if you're interested in having one of these procedures done, you're in luck, because right now they have a giveaway. They're feeling very generous over at Vein Tech. The first 10 callers, you're going to get $50 off any cosmetic treatment. So if you call this number, 210-614-7467, you will get that wonderful discount. And they have 2 locations, and if you want more information, you can go to their website, and that is veintech.com. They've got a location in the medical center, and they've got a location over on Stone Oak Boulevard. Thank you both for
Thanks
being
very
here.
much.
Nice to
Thank
meet you.
Good to meet you.